Hi everyone, my name is Stephanie Gill, and I am a family medicine physician in our Department of Family and Community Medicine at Penn State Health. And so I am located right next door over at Hershey Medical Center, and in our College of Medicine, I see patients across the river in West Shore at Camp Hill. I precept our resident family physicians just down the road at our Nyes Road office. And I think I've been here for the past 8 years, and it's been really wonderful to become more and more involved in oral health as I have been here. And so today I wanted to spend some time discussing lessons and tips that I have learned in integrating oral health into our curriculum at Penn State. I do have some learning objectives being a medical educator, and specifically focused on learning to identify the barriers and the facilitators that basically raised to the top when we were integrating oral health in our medical school curriculum. And thinking about how the lessons that I've learned can be integrated into curricula elsewhere, not just medical school, but any other health professions program. And then thinking about with the health profession programs that you might be involved in, how can you plan for better integration of oral health into that medical program? So every medical school curriculum is 4 years long, and the first 18 to 24 months are all biomedical sciences, so very core, basic, and biomedical sciences, followed by 24 to 36 months of core clinical clerkships as well as clinical residency preparation. At Penn State, our students do 18 months of core clinical, biomedical core organ system blocks. They are very traditional in that they go from block to block, but then through that we have these various curricular threads that are woven longitudinally as well as vertically through the curriculum. And some of these are humanities, patient communication, health systems, evidence-based medicine, and clinical practice, skills that students can then see and learn to link how these various organ systems are connected to these topic areas. Now, looking at the Penn State Health community, we had a community health needs assessment in 2015 that identified an overwhelming unmet need for oral health care services within our immediate health service area. Currently, Penn State Health does not have a dental school. We don't have a dental residency program at our College of Medicine and at Hershey Medical Center. And thankfully, we have a local dental hygienist program at Harrisburg Area Community College, but not specifically one within our doors. But because of this disparity, Hershey Medical Center wanted to allocate attention to developing their oral health services to better meet the needs of their patients. And my task in 2017 was to design an oral health curriculum that threaded through our overall curriculum and could help prepare our medical students to be able to address population health and patient-level oral health needs. So the first thing that stood out to me was that adding an oral health curriculum to a medical school needed cultural and organizational thought change. And so I needed to look back on using Cotter's 8 steps for a process for leading change. Because if I wanted to make a lasting impact in our institution, I really needed to start with the people in our institution. And then that meant, while administrative leadership may have been on my side, a lot of the clinical faculty, and even our students coming into the medical school may not have ever considered oral health as part of something that they were tasked and responsible for doing with their patient population. And so I needed the backing of the institutional leadership to be recognized for this work and also to be supported as an oral health champion. And I needed protected time for this to happen. Fortunately, I received a 5-year HRSA grant that made that possible. And so I could integrate this as part of my professional development work for this K grant that I had. But as I started talking to other faculty from other institutions trying to do similar things, there was a lot of there were a lot of other funding mechanisms that people could think about. So for instance, the state area health education consortiums, coalitions for oral health, professional organizations, even DentaQuest and Delta Dental became places where some of my fellow colleagues looked to get initial kind of seed money to allow them to develop their curricula. The next step was that I needed to conduct an oral health needs assessment of the learning environment. And this was to identify potential partners and stakeholders, funding sources, community needs for oral health care, and spaces within the curricula where I could integrate oral health. I started by doing a textual analysis of course descriptions, curriculum mapping. I did interviews, group discussions, and surveys with course directors, faculty and curriculum leaders, clinical and non-clinical faculty, staff, as well as students. The needs assessment helped me to identify the specific aspects of our overall medical school curriculum infrastructure that were best suited for reinforcing oral health concepts, and then being able to encourage students to consider how these opportunities could use practical oral health skills during those educational components. Also, I needed to gauge our faculty's interest and their experience in integrating oral health. And I also needed to assess the delivery of the oral health care, the healthcare delivery within our clinics to see if oral health and how well oral health could be embedded into the clinical learning environment. So my next step from there was to form strategic partnerships with others and other organizations so that we could work together to improve oral health within the education at Penn State, but also simultaneously engaging others to do similarly at their own institutions. And I found many linkages to be really helpful. PA Coalition for Oral Health, for instance, Healthy Teeth, Healthy Children, professional development organizations like the Society of Teachers of Family Medicine, their curriculum Smiles for Life. Even Harvard Macy has an opportunity to develop medical educators. And so I really used all of those resources I could find to really help myself with developing the curriculum. So the next step was that I needed to be able to make a case for teaching oral health, emphasizing oral and systemic health connections. Many clinicians and medical educators never considered oral health to be part of something that they do, particularly with respect to systemic health. So I had to raise up stories from patients and local health statistics. And I needed to make known any of those teaching and learning wins that occurred in the work that I did. So for instance, I have 2 quotations here. I did not understand the severity of having a dental infection, and the session gave me a better understanding of the systemic problems that might lead to someone having a serious infection. And I previously had never rated oral health as something that is extremely important. So for all of you in this room would be like, what? But for a medical person, they probably never really thought about the teeth and the gums and the tongue. And so having them think about this in the context of the patient's overall health was a real win. And being able to share this with fellow educators as well as leadership was really important by showing that we could make an impact in patients' clinical care. So from here, I needed to be very thoughtful and making sure that our curriculum was firmly located within the context of our overall medical student curriculum. That meant I needed to create the framework of my curriculum within the overall framework of medical student education. I needed clear oral health professional competencies with learning objectives that demonstrated clear knowledge, skills, and attitudes. I really needed to think about the entrustable professional activities that our students could learn through oral health education that would translate to those overall EPAs that our students would learn. And I also needed to think about how these things that our students learned really kind of flowed really well into their residency education so that they could continue to build on that. And when I could demonstrate that to our curriculum leaders, it was really impressive for them because then they could see that oral health had a place within our curriculum and that we could connect one organ system to the next by a patient's mouth. And so that leads me to my next slide here. I wanted to maximize our oral health touch points and think about bidirectional interprofessionalism. What are things that we could do with our curriculum that drew in our dental hygienist students at HAC, that had our nurses join at the table and our PA students, as well as our physicians, to think about oral health. And so we started to develop cases that our students could learn that used all functions of healthcare. And we started to think about how we could connect what our students were learning in their basic science and biomedical organ system blocks into our clinical environment. So that way, as students learn something, it then builds on to the next thing and to the next thing. So you can see I get pretty excited when I start thinking about it because it's been a really phenomenal journey, a lot of frustration, but also a lot of wins. And it's been pretty amazing to see things like this grow over time. And so without being able to without having a clinical assessment that included oral health, I was not really going to be able to prove anything to my faculty and to our leaders. I needed to show that our students, when they came away from their coursework and their clerkships, that they could actually do those skills, and they did skills that they applied to their patients. And so I worked for a couple years and was able to integrate oral health as learning points and teaching points and testing points within their observed structured clinical examinations. And this was a real win because it's very hard to integrate something into the evaluation process that's been going on forever and ever. So having to teach them to make space at that wheel. And finally, I needed to think about our residents and our faculty who our students would be interacting with in their clinics. And I needed to spend time developing them so that what the students are learning in their biomedical curriculum, they were then learning and seeing being done in the clinical environment. And so we had to plan for a number of professional activities, starting with topical fluoride varnish, and really looked at how we could use mixed methods research to inform clinical quality improvement processes within our clinics. And so my hope is that when our students leave, they'll be able to think about oral health as part of their patients' the part of their patients' healthcare, and they'll be able to do clinical assessments that include oral health, provide preventive advice, do dental referrals if necessary, and think about how the mouth affects the patient's overall care and vice versa. In the meantime, my hope is that the things that I've learned through this experience and sharing them with others will also help to inform others so they can do similar at their own institutions. Thank you.